So from this advocacy on HIV, TB, and malaria, we move on to another advocacy where digital health will really be of great help. So on sexual and reproductive health and rights, we have our speakers from the International Planned Parenthood Federation. We have Shivam Shumsher from who is the Digital Health Interventions Officer. We have Dr. Tayyaba Khatoon, and who is also the technical advisor on organizational learning and evaluation. And we have Brayant Gonzales, Senior Program Officer for Youth and Comprehensive Sexuality Education from the IPPF.
Thanks so much for having us on this general meeting here with AN, and many congratulations on completing 10 years. I'm Shivam Shumsher. I work as a Digital Health Interventions Officer at IPPF, and I'm based out of the South Asia office of IPPF here in New Delhi. I'll be talking about the some developments which we have made in digital health at IPPF. So IPPF has been working on digital health for sexual and reproductive health, including service delivery as well as information in the past years. But COVID was one of the accelerators through which we have, institutionalized using digital health interventions. IPPF operates through our member associations who are the service delivery partners on field. So we work across 120 countries across the globe, and we are spread across various regions. Uh, IPPF has recently come up with an IMAP statement, and which is an internal medical advisory panel statement on the use of digital health interventions very recently this month only. And through the statement, the statement is intended for technical agencies as well as program implementing organizations on digital health interventions. So the statement talks about various components on digital service delivery on including information and services, and as well as data management around digital intervention, specifically on sexual and reproductive health-based work. So through this statement, we are talking about principles and processes which we can adopt and scale up for using such modalities for service delivery work, as well as we are speaking on quality of care and what can be the programmatic uh, takeaways which our member associations can do on field. So the statement is largely since we also have multiple clinics and various service delivery models through which we operate. So we are operating through a hybrid conceptual framework which includes in-person digital health and the recently uh, acknowledged self-care interventions as well. So how these three modes of service delivery could be combined for sexual and reproductive health-based work. And the framework largely talks about iterative and adaptive processes, accessibility and sustainability. And how do we talk about including feasible digital health interventions? Uh, and also on quality SRHR service delivery components using a human-centered approach for centered around end users. So the statement also highlights on major key attributes which as a federation we are promoting across member association, which includes leaving no one behind with the focus on accessibility and inclusion, largely how that can be made possible with the conceptual framework which we have provided, and also on clients' rights and do no harm with the recent acknowledgement of the data governance practices around digital health, which has also been promoted by Transform Health. So we are trying to incorporate that in our programming as well, and how that can be taken up in various local contexts, and the use of digital data management on key issues, on issues which are related with a lot of stigma and also surrounding vulnerable and marginalized populations. So how that can be made possible, without doing much of harm. And next we are talking more on quality of care, how that can be made possible through this integrated model which we are talking through in-person self-care and digital intervention. So how that can be made possible across this continuum. And next, we talk about sustainability, which is a major component, I think, which we are all discussing, which can be made possible through partnerships on leveraging resources across various organizations and interest partners. Uh, Importantly, we are also looking on how we can measure such interventions, because sexual and reproductive health uh, can be an area where there might be a lot of issues around how do we manage that data and make sure that we are learning on such new models, because there has to be certain behavioral components which also gets addressed, which leads to the next segment on the IMAP statement, which talks about the client engagement and satisfaction matrix. So we have come up with various indicators around how, when we are designing or implementing digital health interventions for sexual and reproductive health, how those metrics and engagement formats can also be brought into our programming across various member associations. And I'm very happy to share that the Digital Health Week, which is being organized by the Transform Health, will be speaking more on these with our member associations, which will also be an opportunity for us to discuss these segments in a more elaborate manner. So that's from my side. I'll pass it to Dr. Tayyaba, who will be sharing some more insights from some program implementation. Over to you, Dr. Tayyaba. Thank you.
Thanks, Shivam. Thank you, everyone. And hello, everyone. I'm Dr. Tayyaba. Yeah, I'll be mostly sharing the learnings from Afghanistan on digital health intervention. It's kind of a hybrid model we implemented in Afghanistan. During COVID-19 pandemic, our member association in Afghanistan, they implemented this community-led midwifery digitally enabled intervention with the aim of reducing the high risk conditions among pregnant women and lactating mothers. And this was fully implemented at the community through the midwives with the support of 5 gynecologists. In Afghanistan, our member association, they had set up a call center at the headquarters, and in 10 provinces, 150 midwives were assigned their project practice area, and they were delivering SRHR and RMNCH, that is reproductive, maternal, neonatal, and child health services, using different digital tools and platforms. So it started with the training of all the midwives on basic obstetric care services and SRHR, the IPA services. The training was also planned on a web-based application called SIM Capture. Each com or the midwife was given an individual account where she could access all the materials, the learning materials, which was uploaded on the website, and they could also attempt the pre and post tests before any training sessions we organized. At the same time, all the comps they were given, the midwives, they were also provided the Anandima antenatal kit, which was the basic diagnosis devices they used, and they were also equipped with the delivery kit. And as and when they identified the pregnant women, screened them on the high-risk conditions, they used the tool called Care Mother application, which is the Android-based application, where they used all the parameters for screening the mothers, basically the pregnant women and lactating mothers, for identifying their high-risk conditions, and accordingly they were provided the continuum of care services. So apart from providing ANC and PNC services, midwives, they also use DHIs to mobile-based tracker for providing SRH services to all the clients, including women. So these are the multiple digital tools were used in service provision, and they were technically supported by the gynecologists, which were sitting in the call center, and they were very well connected virtually with them. And as and when needed, these midwives, they were also trained on conducting home-based deliveries, basically. So COMs, they needed support from when they required support during conducting the home deliveries. They always connected virtually connected through audio or video with the gynecologist, and fully supported by them. And this is how they are delivering the services at the community level. This happened during COVID pandemic, and also this model was benefited during the Taliban takeover, that difficult time they faced, and when the facilities were not fully functional, and there was lack of service providers, there was stock out of medicines, and all those obstacles were there in accessing these kind of services. So this model worked in the community for filling the gap of service provision. So that's it. If you have any question on this, thank you very much.
Thank you, Dr. Tayyaba. I am Brayant Gonzales, Senior Program Officer on Youth and Sexuality Education, based at the Kuala Lumpur Regional Office of IPPF. I'm working with Dr. Tayyaba and Shivam, and I'm delighted to be part of your general meeting and talk about IPPF's work on young people's SRHR and digital health intervention. Upholding young people's right to SRHR is central to the mission of IPPF, and IPPF's approach to youth programming aims to improve young people's SRHR and empower them to make decisions and exercise their sexual and reproductive health rights. In 2021, 43% of our services, or 98.4 million SRH services, were delivered to young people, and 34.8 million have completed quality assured comprehensive sexuality education programs delivered by IPPF member associations inside and out of school. Young people are central to IPPF's work in leadership, governance, staff, service design, and delivery. And young people are key drivers of change. As the most diverse generation the world has ever known, youth movements are intersectional, and in the digital age, observe few borders. Young people are more connected online to access SRHR information and services. The COVID-19 pandemic has heightened the importance of digital health interventions. Educators are reaching more young people through innovative methods to ensure access to SRHR information anytime, anywhere. We acknowledge the centrality of technology in all we do, including leveraging social media as a powerful platform for accessing SRHR information and services. At IPPF, we believe that young people should be included at every stage of designing digital health interventions. Young people's engagement should be sustained and meaningful. Youth-centered digital health interventions should respond to a clear problem statement or health system challenges. This includes a careful consideration of the context, including equity of access by specific targeted young clients. The health information and technology delivered are the interventions for. Digital health interventions should be developed using an iterative cycles to improve content and delivery methods continually. Because of our focus, IPPF is reaching out to more young people especially the most marginalized. We have improved our youth engagement through increased investment in and engagement with youth groups and youth networks. We will further work with youth networks to shape and deliver change agendas. We are also committed to furthering comprehensive sexuality education and expanding best practices and advocating for supportive legal frameworks. While we are continuing our offline work, we have explored digital avenues for greater access and reach. And hundreds of millions of young people get their information about sex and sexuality online. IPPF will improve the quality of sexual information on social media platforms and link better to care continually. Through better use of technology, IPPF has expanded its services to reach and bridge social and geographic divides, make greater use of dashboards to support data-informed decision-making, and more adeptly share data across the entire federation. Yeah, thank you very much.
Thank you, IPPF. I know that you've been supporting AHIN also, and it's good to know actually that digital health is part of your agenda at IPPF. I actually, at the University of the Philippines, I teach also about sexual and reproductive health and rights among the medical students, and hopefully they will also be more conscious about the use of digital health in reaching also our the youth at this point. So thank you again, and we'll see you in the next few days.